I think everybody has retrenched some. Last year, there's an article in the Wall Street Journal today which points out that last year, in the first year after the financial meltdown, the United States increased its actual contribution by 10%. And almost all of Europe and Canada flatlined theirs, but together we were able to, have a tiny increase. This year, the United States has cut back on the amount of increase. I think they're increasing, maybe 2% this year. It's not enough, but there are serious budget constraints in the congressional process, so that the same countries that need more help in medicines for AIDS have come to the Secretary of State, the AID director, the White House, and said, please help us build our healthcare systems. Please do more on maternal and child health. So even the people where a lot of the AIDS patients are saying this. And I think the president did what he thought was the best he could do, and he knows perfectly well that it wouldn't cost very much more money for us to put up the money. But under the congressional budget rules, they have to agree to put more money in. Now, they did actually last year put some more money in. I think we can get them to put some more money in this year.
You seem fairly satisfied with Obama's domestic plans, but are you pointing the finger here at G8, G20 donor countries who simply aren't stepping up to the plate, are they?
I'm saying that they felt they had to retrench even before we did, and that he showed good faith in supporting a nice increase last year, and so did the Congress on a bipartisan basis. That this year, so far, they have not done that. But keep in mind, the final budgets for the United States have not been adopted this year, which is why I encourage this group, instead of to go and explain the situation to Congress, as Bill Gates and I tried to do, if they will just lift the cap on overall health appropriations and development assistance, they'll get more money for treatment, and the president will sign it.
If you had one message to those countries who appear to be reneging on their commitments, what would it be?
My message would be, first of all, that if we all do this, the consequences will be calamitous, and you'll spend more money later. You start having huge numbers of people dying again, you'll have more political instability, more economic collapse, and it's going to cost us more money later. So it's not only going to be a humanitarian crisis, if at all possible, hang in there. Second thing I would say is that we shouldn't be penny wise and pound foolish in an interdependent world where we worry all the time about terrorism, we worry all the time about violence. We have to spend some money to make good things happen, to give people a chance to live their dreams. And if you look at it, when President Bush's and America's approval went way down all over the world because of the Iraq War, there were 3 places where it didn't go down. In India, where we made a deal for peaceful nuclear cooperation. In Central and Eastern Europe, where we continued my policy to expand NATO. And in the 10 countries of Southern and Eastern Africa, where PEPFAR was concentrated and the highest AIDS rates were. And did they agree with President Bush's Iraq policy? No. A lot of these countries, Tanzania, Kenya, huge Muslim populations. Why did they still like him? Because they thought he and the United States cared whether their children lived or died. That's why. We don't want to be penny wise and pound foolish. You can't just spend all your money stopping bad things from happening. This makes good things happen, and we have to do that.
But who do you really want to shake at this point?
I would like to see the Congress, every year they make 1 or 2 exceptions, not big, to the budget rules. I'd like to see them lift the cap on this and put a little more money in to encourage others, because this is a rebuilding year for the Global Fund. I would like to see all the other countries that started their cutback a year before we did do the same kind of soul searching and ask themselves what's going to happen. I also think, since the economy is coming back, it may be that everybody should consider making clear that over a 2 to 3 year period, they will give 3 years worth of money. So maybe they get 1 more year of giving less, but it means in the next 2 years they'll give more. There's 1,000 ways to work this out.
Scientists are still searching for the Holy Grail, a vaccine for this AIDS virus. How close are we, and what is holding it up at this point?
There is a preliminary indication that sometime in the next 2 or 3 months we will will get some reports on vaccine tests which are very hopeful for the quick development of a vaccine that actually works. Meanwhile, we know that if you start people on the medicine, not when they have full-blown AIDS, but as soon as their so-called CD4 blood count drops below a certain amount, it can prevent 90% of AIDS. That's about as good as a vaccine. It's not 100%. But if we just could do that, this whole epidemic would be in a different place within 5 years.
Ali from Bangladesh has written to us. He asks, how easily affordable do you think a vaccine will be for people in poor countries?
In most places, the donors are providing this medicine. And what I would say to your questioner is this. You should be able to get that help right now, because I have negotiated great contracts for this medicine all over the world. And if you can't, you need to get in touch with us directly, and I'll try to make sure it happens. Because in any poor country, the people shouldn't have to pay anything for it.
Joseph has written to us, Mr. President. He asks what you think has been the most effective method of spreading HIV and AIDS awareness.
In poor rural places where people don't have television, the most effective thing is when young people who are themselves HIV positive go to places where there's been stigma, there's been ignorance, there's been fear, and stand up and simply refuse to see themselves as victims and tell people how they were infected and why people should take all the necessary preventive steps.